everyone. My name is Kimberly, and I am currently with my family in self-quarantine for about a month. We live about 20 miles outside of New York City. Today I have had the privilege of interviewing Dr. Sofia Shapiro. She is an endocrinologist at Caremont Medical, and we are going to talk about type 1 diabetes and its interaction with the coronavirus. What you can do to stay healthy, what you can do if you feel sick or are sick, and what you can do also to help calm some of the nerves and reduce some anxiety. So welcome, Dr. Shapiro. How are you?
I'm fine. Thank you so much, Kimberly. How are you?
We're good. You've been in self-quarantine as well for about a month, correct?
Well, yes, I was first quarantined because my children go to one of the schools in New Rochelle that was, the
Yes.
site where one of the first two cases happened. So that was the first 2 weeks. And then because of my work, once, 2 weeks ago, I, together with my staff, made the decision, since I'm a pediatric subspecialist, and thankfully, due to many of our type 1 patients having, remote data sharing capabilities, and frankly, to protect our, patients and myself, I'm doing strictly telemedicine right now, as you said, Kim. So I am home. Um,
Yes. So in your practice, have you come across anyone? It's been about what, 6 weeks, I think, since it's about we've had it here around us. About 6 weeks. Have you come across any patient that has been diagnosed with the coronavirus?
That's a great question. So on one hand, I'm not on the front line, so to speak, like many of our general pediatricians who see everything from, fever and, cough from COVID, but also regular influenza and ear infections and such. So I'm not exposed in that way. But I have had patients who later have become affected and called us and said, I'm positive, and I saw Dr. Shapiro 3 days ago. And I actually had myself tested because of this, because I also didn't want to be a vector and expose others. I was thankfully negative. This was about 2.5 weeks ago. I should also mention that my husband is in the front lines at Bellevue Hospital at NYU, so that's an additional risk. Right?
Wow. Incredible work.
Wow. So I think at this point, Kimberly, you probably as well know someone, if not in your extended family, maybe in your close circle or friends of friends who have this condition. So even though I haven't had anybody with fever and cough whom I have seen, and that actually is also thanks to our staff and administrative team who screen patients for that very reason, right? And we'll talk more about this, how to prevent further exposure. I haven't personally had a case that I've diagnosed, but I certainly have been exposed to patients who have later on become positive.
Yes. Yes, I can also share that I've had two patients of mine pass away from the coronavirus. And I currently here in Westchester know of a handful of people that are struggling with it. So what a unprecedented time. And with type 1, certainly we're doing this because there could be special possible risks if you have type 1. Is that true? If you have type 1, that you're more at risk for getting the coronavirus?
So another excellent question. So it depends, right? We are dealing with mostly pediatric patients, right? Up to 21. And I should also preface this by saying that everything I'm going to share with you today, most of it actually comes from the excellent JDRF post on type 1 with COVID, and also from a national, guru, Dr. Ann Peters, who's also on the website. So I'm by no means an infectious disease expert, but, as a pediatric endocrinologist, just want to put that disclaimer in. So if you have type 1 diabetes and you're what we call well controlled, right? Thankfully, most of our young people are, with no kidney problems, with no eye problems, with no high blood pressure. Actually, we're not at any increased risk. We're not what we call immunocompromised, right? Yes, we have a chronic condition, but that chronic condition is almost, certainly different to, but similar to kind of celiac when we, don't have multiple organ system kind of risks, right? So in that case, two things. You're not at an increased risk of getting it, right? When you're exposed. And if you do get exposed, right, if you have the fever and the cough and you feel you have it, you're not at an increased risk of having the more severe case, which is also, I think, very reassuring.
That's very
kids and our parents and doctors like myself.
Yes, I do see out in the news a lot. They say people with diabetes. Can I assume that that's a lot more geared towards type 2 diabetes, and obviously, like you said, it's a diabetes situation where it's not being managed accurately or have consecutively high A1Cs.
Exactly right. They're mostly talking about older individuals, mostly type 2 individuals, some type 1s who are older and have complications, right? But that said, even though we're not at high risk of getting it or high risk of getting the more severe type if we do get it, we do have a chronic condition, right? And so
Yes.
if we do get it, it's harder for people with type 1 to manage it than without, because not only do we have to, worry about, the fever and the cough and the dehydration, we also have to worry about managing our blood sugar with all those factors.
For the type 1 diabetic out there that suspects that they have the coronavirus, they're starting to cough, they have the fatigue symptoms that come along with it, maybe some body aches, what is the first thing you can recommend that they do?
So that's another great question. So as you know, over the past several weeks, the guidelines have been very, fluid and shifted. When we were one of the first few cases, right, it was very important to get tested because then you could kind of trace the contacts and notify them. I think we are well aware that we've moved beyond that, and actually testing have almost taken like a, kind of a step back, because now so many people are exposed, so many people have the condition. So I would say testing is really not a priority, because if you have symptoms, if you have fever, if you have cough, if you have myalgias, other common things could be, loss of sense of smell or taste, some GI symptoms like nausea, diarrhea, right? So you kind of say to yourself, I probably have this, right? So you don't need to be tested. In fact, most urgent care centers, pediatrician and internal medicine doctors, do not recommend testing, okay? Because what can happen is if you go out, right, and you go to an urgent care center or emergency room, there you're encountering that population that's so much sicker, right? Which we'll talk about when to go to hospital. So you actually, even if you don't have it and you have the routine flu, let's say, you're much more likely to get it, number one, there, right? It's not going to change. It's going to send you home and say, please self-isolate at home. And even if you do get tested, the results are coming back delayed, right? At best, in urgent care centers in the hospital, 24 hours. But you can imagine 3, 4, 5 days in the beginning when this was started, 7 to 10 days, right? So it's not gonna, change what you're doing. And now that we're peaking in this pandemic, by far, most recommendations, whether it's from the governor's office, whether it's from your local, support group, from your, religious group, is to stay home. And even when you get sick, you try to manage at home. I should also mention that about 80% of the time, thankfully, they call it, a mild illness. Now, mild may not be mild for everyone. Certainly cough, fever, if you're a toddler, it's not mild. And, so many celebrities out there shared their experience. It can be quite rough, right? Fever, cough, not sleeping at night. But it's still, relatively speaking, mild in terms of severity, where, 80% of the cases can be managed at home. 20% get a severe illness, right? That's when you have shortness of breath. That is key. If you have shortness of breath, that's the person I would say, go to the emergency room.
Yeah, I was going to ask that. So people, so they stay home, they treat themselves, I'm assuming, as if they would if they had a cold or a regular flu. And so if someone starts to experience shortness of breath, you suggest that they at least, I guess, call the doctor.
Exactly. Let's talk about that. Yes, that's another great question. So remember, your pediatricians, your internal medicine doctors, your pediatric neurologists, like myself, are there for you. We're not there physically, right? Many of us are doing telehealth visits for that very reason, meaning that, and a pediatrician may want to see that baby if they have high bilirubin or something that can't be deferred, right? But they can talk to you and prevent you from getting exposed and others from getting sick via telehealth or video call, and ask you about your symptoms and say, I'm so glad you called, I'm so glad we did this, you're right, you may have this, and now here's what we're going to do. You're going to monitor your temperature, you're going to stay hydrated, and all these medical recommendations can be given safer now. Like you said, Kimberly, during these unprecedented times, we really try to only leave the house when it's absolutely necessary, right? At most, grocery shopping once a week, all those social distancing recommendations, and we'll talk about in a little bit about how the virus is transmitted. But really, use your pediatrician, use your internal medicine or family medicine doctor, pediatric endocrinologist, adult endocrinologist. They can still talk to you versus via telephone or visit and give you further recommendations.
Do parents and children have rights if they end up having to go into the hospital? I can speak for my husband and myself that, worst case scenario, that my daughter ended up having to go to the emergency room. We would feel most comfortable if one of us could be with her because she is type 1. And a lot of times it's the parents that know their child even better than the doctor, and certainly during a crisis, the diabetes management might be secondary. Do you know if a parent can be allowed into the hospital room with their child?
Right. So that's very difficult because on one hand, most emergency rooms right now do not allow any family members, which is shocking, right?
That's the terrible thing here, where people need the love and support, but they got to be isolated.
Exactly. So in pediatric emergency rooms, they're trying the best they can to isolate the respiratory and COVID suspicion cases versus the still kind of routine appendicitis and in our case like DKA, right?
Yes.
They're doing the best they can. So at this point, at the discretion of the attending for that person, they feel that they're, safe and this is not a COVID affected family. But frankly, at this day and age, we could all be asymptomatic carriers. So even in that situation, especially if you feel the age of the child, right? If it's a more like adolescent kind of young adult, they'll be more likely to kind of minimize the risk. But if it's a toddler or a young child, it's very difficult. But even then, I'm sure they may only allow one parent versus as before, more.
Oh, yes.
And that visitor will wear, PPE, right? Personal protective equipment, mask, gown, because let's face it, we're in either urgent care or emergency room where as much as they try to separate, it's becoming more and more challenging.
Yeah, obviously, everyone's doing the best they can. Do you recommend having on hand in the house any over-the-counter medications in case someone does develop some symptoms? One thing I also wanted to ask was, how about Tylenol over Advil? I know that's a lot of going around in the emails that Tylenol is recommended.
Let's answer that second question first. So initially there was a concern that, anti-inflammatory drugs, may, exacerbate, COVID presentation if it happens. But that myth has kind of been debunked, because some data, right? Now, in our type 1 population, we always worry about the sugar content, right? Especially for younger kids.
Yes.
All these acetaminophen or ibuprofen have all these sugary additives, right? So that's very clinician dependent. Where I trained, the thought was that, if you have fever and your blood sugar is high from the fever and from the pain and the distress that the child may be having, that little sugar content will not make a big difference, right? But that said, many people feel, whether, clinicians or patients, they may say, you know what, if I can minimize that and take a formulation like a pill, older children, young adults can certainly do that. we can try, right? Because why have that additional sugar content if our blood sugar is already high, right? So that to me is kind of a more minor point, but I think so far the data has shown that any, anti-fever medication, whether it's Tylenol, Advil, Motrin, if it brings the fever down, more about the COVID aspect of it. I should also mention that before, for people who are wearing continuous glucose monitors, it was believed that Tylenol, especially in the older ones, certainly could affect the accuracy of that. Now we're fortunate in that the more, newer continuous glucose sensors do not have that interference. So I'm kind of grateful that in these challenging times, again, at least that is not a concern, right? Because you want to have a reliable sensor. You want to have reliable information, especially when we're making such important decisions about how much insulin to give our kids.
So you talked about Tylenol and Advil. I just wanted to spend a tiny bit more time about the conditions with our lungs, the congestion and the cough. Would it be okay for a type 1 diabetic, or just really, I guess, anyone to go get Robitussin or something over the counter? I'm assuming if you have some symptoms.
Right, so two answers to that question. The first one is kind of, do we think it's this COVID viral pneumonia? Do we think it's something else, right? So that's where I think, don't underestimate the role of the pediatrician in this, right? Because certainly, that's the first step, and they can do a telehealth visit with you and say, do you have a fever? Do you not? How high is the fever? Were you exposed? Or, some medications can cause cough, some ACE inhibitors, for example, for older people. So, just to start there, kind of, what do you think, right?
Yes.
Robitussin is a kind of a relatively benign kind of, to break up the cough. So if your pediatrician feels it's fine, right? Now, additional factor to this is if you have this at home, it's good. But what if you don't, right? Would you risk, leaving and entering a pharmacy where somebody could really be a carrier, right? And getting you sick? Or is this not such a, kind of just a small drop in the big bucket of things where you can say, okay, your pediatrician, if you don't have it, let's not do that. Let's do something else. I know many pharmacies started delivering now, so that's easier, right? So
Yeah.
It's case by case basis. Now, the second tier for type 1 patients, a lot of these Robitussin medicines do have added sugars, right?
Yes.
That's another something. If your pediatrician really feels that it would help, right, the cough, and you feel kind of comfortable managing, the blood sugar is already high, a little bit higher is not going to be a big deal, fine, right? But if you're really struggling to keep the blood sugars under 300 and you feel like it's, the pediatrician feels it's not the best way to go and may prescribe something else like, azithromycin, or feels that it's really something else, then you may say, you know what, we're not going to do Robitussin. We're going to do antibiotics right away or something like that. So I really to our pediatricians on that. And Kimberly, since we're talking about medications, I'm just going to take a little caveat to add. It's really important to have, right, as I'm sure people know, for our type 1 patients, enough supplies, right? So
Yeah.
or we could just, run out to our local pharmacy anytime and pick up extra insulin, right? Now is the time where we have to be extra careful, right? For those two reasons, not only to be exposed or, to expose others, but also we don't know what's going to happen, right? Thankfully, so far, all of our pharmacies, all of our specialty pharmacies, all of our dedicated, type 1 diabetes communities from any and all, pump companies, sensor companies, insulin producing companies have been extremely, supportive, and they've, cut out all the red tape, and you can get refills sooner, and they're really amazing, and they're reachable by phone or email, and are really there for us. So we're really grateful to all of them. So thankfully right now it's not an issue, but in case something gets interrupted, in case transport is halted, so I recommend to have at least a month, ideally 2 to 3 months of extra supplies at home, so that, God forbid, if something changes, if that supply chain is interrupted, let's face it, for our type 1 patients, insulin is vital. We can't go without it. And the delivery of it, the needles, the syringes, the pump reservoirs are equally important, right? So we really have to have that extra supply just in case. I'm sure you guys, are pros and already know.
Yeah, we've always been pretty vigilant about keeping some extra supplies on hand, thank goodness. In your opinion or in your practice throughout the years, when a child or someone gets sick and they have a fever, how does that specifically affect their blood sugar?
So for most patients, whether they're younger patients, teenager, older patients, it raises their, right? Fever usually raises their blood sugar. And this is why we also advise, again, for most people, to raise their basal insulin, whether they're on a pump and they can do a temporary basal rate of about 10%, sometimes you need more, 12 to 15%. For those daily injections, we recommend to take that basal insulin, whether it's Basaglar or Lantus, Levemir, and about 10 to 15% more.
Yeah.
Now, some patients actually experience lower blood sugar, I think, because they're not eating as much, right? So when you're used to having all your carbs during the day and you're kind of, cruising along in that happy medium, and then you get sick, yes, you may be a little bit higher from the fever, but if you're not eating, if that last meal really wasn't a meal, you may actually kind of even out, right? So Kimberly, you bring up a great point about just sick day management, right? Versus it's COVID or influenza. If you get sick, keep in mind we're armed with pretty good guidelines. We've been experienced. Most of our patients have had type 1 for a while. They know kind of how to weather the illness, right? So trust your instincts. For example, whereas we usually bolus 15, like basically right before we eat, because it takes that 15 minutes by the time you break down your food to start working. When we're not sure if we're going to keep it down. Certainly young kids, right? They can either say, oh, I don't want this pizza anymore because they're not feeling well. Or even for us older, right, individuals, you may think you're going to eat it and then you take 2 bites and you really can't. Well, worst case, you throw it up, right? So when you're sick, this is the one time I would say don't bolus. Wait to see if you really keep it down. Wait to see how much of that meal you've eaten, and then bolus or correct, right?
Yeah, that's great advice.
Yeah, wider guidelines, whereas before we try to be like 70 to 140, 150 most of the time. When you're sick, you don't want to go low, especially if you have no appetite and you're nauseous and you're going to throw up. This is not the time to be 70, okay? Widen those margins. Be like 70 to 200, 70 to 250. As long as you're checking for ketones, right? And, if you're a little bit high, that's okay, right? You're monitoring, but it's good to have that wider margin, because lows, when you can't keep things down, is, more acutely concerning, right? Other things, keep hydrated, right? Food is important. It's not as critical, right? And now more and more data is coming out how one of the most serious complications of COVID is that people become very dehydrated. They use so much of their energy for respiratory. They have a viral pneumonia. They're losing weight. They're not eating. It's a lot of energy the body's using. It's important to keep hydrated. But for type 1 population, that's an even added concern, because not only do we be hydrated to fight the virus, we have to be hydrated to prevent DKA, right?
Yes. Often I've heard from other families that have had just the regular flu, very quickly they can have moderate to large ketones. Could you just talk about that a little bit again? So when do you start really checking for ketones? What do you do if you have trace ketones? So you keep your fingers crossed you don't get larger ones. And then what happens if there's no getting around this? You can't keep anything down. You're sick. You have a high fever. Do you recommend going to the hospital? It sounds like you might need an IV drip.
Right. So all excellent questions. So ketones can form for 2 reasons. You can have like garden variety ketones because you have a viral illness and you're just not eating, right? Ketones is a good thing. It means that if you don't have, 6 hours, 8 hours of carbohydrates, your body's starting to break down fats as fuel, right?
Right.
But in type 1 people, ketones can also be kind of a first step towards diabetic ketoacidosis, right? That means that our insulin amount, relatively speaking, is not enough, and our fat stores are being broken down sooner, let's say, than should be because we didn't have enough insulin to break down our carbohydrates.
Yes.
So we always recommend to check ketones when you're high, right? Even if you know that you're high because you have fever, but it's good to see where you are in that, map. Trace ketones are not as concerning. Of course, it's better to have negative ketones. Trace ketones are kind of mild, right? So in that case, usually you don't feel sick, or if you do, it's not from DKA. It could be from the virus or illness you're experiencing. So that's when you say, okay, what's happening? Am I sick? Did I not get that last insulin shot? Is my infusion site a little bit out? All these things you have to troubleshoot. If you are in a pump and you're high and you have trace ketones, I always teach my patients you have one shot, meaning you get one chance to correct through that pump. And if in an hour it doesn't come down, it has to come out. You have to change out. And I would also give an injection via the pen or a syringe, right? So you take the pump out of the equation.
That's actually, I'm glad that you mentioned that, because in our house we always have our protocols, and anytime my daughter's had ketones, we often don't even play around with it. We just go immediately back to the pen and we give her an injection and we monitor her closely.
Mm-hmm. That's
Yeah.
smart. That's very smart.
Yeah.
Dr. Shapiro, what do you recommend in terms of foods and in terms of liquids that we make sure we have on hand? Gatorade, things like that, just in case we get sick. And you mentioned the importance of hydration.
Absolutely. So, for type 1 patients, we don't usually drink sugary drinks unless we're low, right? And yet
Yeah.
you need to get electrolytes, because if you only drink water, water is a great hydrant, but it's really not great when you're losing electrolytes, whether it's in diarrhea or just from prolonged periods of not eating, right? So that's when things like Gatorade Zero or sugar-free drinks like ginger ale can really help, because they do have some electrolytes to replenish those that were lost. In terms of foods, just like any illness, we recommend bland foods, foods that are easy, like toast, banana, rice, apples, right? And again, we're not being strict here with 70 to 120. We're really trying just to keep that nice balance between being well hydrated, having ketones, right? And let's face it, it's challenging as it is for any child or young, adult or a teen with any kind of viral or bacterial illness. But to add to that, type 1, when we have to walk that tightrope between not being too low and not being too high, during the illness phase, I would say err on the side of a little bit higher, because if you're knowledgeable about DKA and you know how to prevent it and you're checking, right? And one of the questions you asked earlier, to me, if you're vomiting, right? You could be vomiting from stomach virus, or you could be vomiting from DKA, right? So ketones are telling in that case. If you have trace or small ketones and you're already watching it and you're hydrating and you change your infusion set or you gave the injection and you're really watching it, it takes time for the ketones to clear, as long as, 12 to 18 hours sometimes for them to start to go down, right? But the blood sugars will come down first. And as long as you're feeling overall better and you're able to keep it down, right? And the ketones are going to the right direction from, let's say medium to small to trace, you're on the right track. But as unfortunately happens, and sometimes we have no control, let's say you went to sleep fine and overnight the pump infusion set came out and you're waking up and you're 400 and you have moderate or large ketones and you're vomiting, right? So that's true DKA to me. By that point, it's almost too late because you've been X number of hours without insulin, right? And another important thing I want to share with everyone, Kimberly, and I'm so grateful that you're doing this, is that in an ordinary time, right?
Yes.
I would say, absolutely, go to the emergency room. You need hydration, you need an IV drip. But in these scary times when most of our emergency room staff is so busy with COVID patients, I'm so scared to send a patient, because then I'm sending them really to be exposed. Not only them, their families, even if they're not allowed to the emergency room, just being in that outside environment, they can be exposed. And what if our parents live with an elderly person, right? With their parent? What if, they go to the grocery store and they transmit that to an elderly person, right? So we're all in this together. So I've been trying to speak to all my type 1 patients, and I'm sure everyone knows this already. During these challenging times, we have to be even extra careful, meaning if you kind of been laissez-faire and say, okay, yeah, I didn't take my Lantus tonight, or I'll take it tomorrow morning, we have to do everything that we can to keep our type 1 patients out of the emergency room for all these reasons, for their health, for their extended family's health, for everyone's health, right? This is time to be extra vigilant about your control, to be in great communication with your family. We have to tell our kids, listen, if you're high, you have to tell me. Same thing, people without type 1, they're playing and rumbling, home, and you say, this is not the time for you to break your ankle. This is not the time for you to get a cavity, brush your teeth. We have to be so careful.
So Dr. Shapiro, you bring up a lot of really great points. Say there's a family that's debating that if their child needs to go to the emergency room, whether it be, large ketones, fever, or, shortness of breath, and they clearly see that the situation is declining. We know that there's a risk, obviously, to get COVID, but there's also a risk to stay home. How can that parent best prepare their child if they know they have to go to the emergency room or go to the hospital and they won't be able to stay with a family member? How can they prepare that child for what they're about to, go into?
Right. That's very hard. So let me just first say that we've been very blessed in that, for a reason that we still don't understand, most people who are affected are older, right? Kind of the pediatric population, knock on wood, even though there have certainly been cases, by far, most people are over 20 years,
Okay.
even 30 to 40, right? So most people,
God bless.
though we have had in their 30s and 40s, and we've have had teens and infants, but those have been thankfully few and far between, right? So it's rare, and we can actually say that to reassure our children that, in the big scheme of things, yes, we're hearing all these, heartbreaking news stories, but for the most part, right, people who are affected are older, usually with serious chronic conditions, right? And for the most part, children are not affected. And if they are, they have a, upper respiratory illness like a viral pneumonia. And you may even tell them, remember when you were sick with pneumonia, you had fever, and Dr. So-and-so gave you antibiotics, similar to that. So that may make our children a little bit less anxious, right? But if it happens that one of our young adult patients is sick with high fever and shortness of breath, and they've been managing at home, and they feel they're really deteriorating and they're short of breath, absolutely, at that point, speak with your, primary care provider. Thankfully, now that we've been in this for a while, there's already kind of a chain of command, so to speak, where that primary care provider will probably call the emergency room and tell them about the patient, so they'll be waiting for them. And you may tell your child, okay, we're going to have to wear a gown, we're going to have to wear a mask. This is all to protect you from people who are more sick, and to protect other people from you if you do have this virus. And you can say that, there are going to be doctors who are going to be taking care of you, who know what it's about, and tell them kind of the hard part, that they may not allow us in the room with you.
Yes, yeah, I agree that it's good to be really clear about that's a possibility, so they're not looking for their parents.
But even though it's individual at each urgent care center or emergency room, more and more patients have told us that, if that affected individual has a smartphone, right, he or she will be able to use it. So you can see your loved one, in real time. You can do, FaceTime, WhatsApp. Now, the nurse may not be able to touch that device, or, because of her risk, but, in proper PPE or personal protective equipment, she, will turn it on, let's say, if the child is having trouble, but she won't be able to use her own phone.
Yes. So I will just speak a little bit about the elderly, because obviously, like you said, they're the ones most likely, if there's going to be a complication, would go to the hospital. How can they self-advocate for themselves, and how could a family member who cares for their elderly, what is some really key important things that they need to make the medical staff aware of? Clearly that they're a type 1 diabetic, but beyond that.
If they have any chronic associated conditions, I would say most importantly, if they have renal disease, right? If they, God forbid, are really severe on dialysis, right? That's very important. Any liver associated conditions. Eye disease, even though that's certainly concerning, is not what we're talking about. This disease affects primarily lungs and also kidneys, right? So those are important factors to tell someone. If they're on any, steroids for any other autoimmune conditions, right? If they have lupus or rheumatoid arthritis, right? That makes them additionally immunocompromised. And I think for our elderly, the best tool we have is really prevention, right? Because they're at such higher risk that if you're a child of an elderly parent, right, you have to do your first and foremost to not bring that home, right? So I'm going to tell you some things that I am personally doing, knowing that my husband is on the front lines, and I actually have a live-in babysitter with me who's 65 years old. And everything I'm going to tell you now has actually been shared, by multiple, infectious disease experts, those that have been on the Ebola front line. So I'm really trying. It's not easy, but some things. So for example, number one, we must stay at home, right? You hear that all the time, but people don't really get it. They say, oh yeah, I'm at home, but I need to go here and I need to go here. So you have to minimize that trip, really consolidate it, at most once weekly for groceries. If you can, spread it out to 1.5 weeks, right? Really try your, first and foremost, walks. I mean, if you live in a secluded area where there's nothing but, trees around you, that's certainly fine. But if you live in a more suburban area, right, and you walk and somebody's walking across from you, right, during those, few seconds, right, certainly want to keep 6-foot distance, but, these droplets, right, they can hang out in the air, even when somebody's talking, right? So they're transmitted, if you sneeze, right? So we have to take that extra precaution.
Yeah.
First and foremost, try your best to really stay home. And then if you have to go out, right? Now, guidelines have changed because let's face it, it would be great if we could all wear masks earlier, right? But we didn't have those masks. We wanted to save them for our, doctors on the front lines, nurses, medical technicians. So the guidelines have evolved, but as of now, the recommendation is to wear a face covering, right?
Yes.
Whether it's a cloth or a mask that's not like the N95 that should be reserved for healthcare workers. Gloves, gloves are great if you know what to do, because let's face it, ultimately it's transmitting something to our mucous membranes, right? So you're much as likely to touch something wearing gloves, right, to your eyes than not, right? So gloves really is more for healthcare workers, but the face covering will prevent you from sharing those droplets, from getting those droplets. But the other recommendation is really try really hard not to touch your face. Be so mindful, meaning you get out of the car, right? Everything you touch, your keys, your phone, right?
Yes.
And what it takes is a little bit of touch, your contact lens, this, that, and that's it, right? So when you touch that cart in the grocery store, right? And then you enter your phone and then you forget to disinfect your phone when you come home and then somebody calls, right? And then you touch your eyes, right? So this T-zone from the eyes across to your nose to your mouth, right? So be very mindful. Some people wear glasses now instead of contacts, knowing that they're less likely to touch their eyes, right? Keep in mind, the virus lives on surfaces, right? On plastic, it lives up to 72 hours, right? That's 3 days. On cardboard boxes, 24 hours. On metal surfaces, every doorknob, every elevator button, right? Anything metal, that's 2 days, right? That's another reason we're so reluctant to have patients come to any medical facility, right? That's like, right? You're touching everything as much as you try not to. So when you're out keep your hands below the waist as much as you can. And then, most importantly, when you get home, right? Dr. Gupta on CNN shared like a clean area and a dirty area. You disinfect everything, any disinfectant, because the virus has a little bit of a lipid outside. So anything doesn't have to be Clorox, so Lysol, soap and water, wipes.
Yes.
It, wash your hands, right? And then the cell phone, the keys, spray it, wash it, and then hopefully, right, if you touch something, right, once you enter your home and you wash your hands, also delivery, right, mail, same thing, cardboard, try to disinfect those. Some people leave their things for a day or two if they can in the garage, so the virus that's on the surfaces,
We've been getting our food delivered, our groceries delivered, and I'm so thankful that there are people out there that will be able to shop for us. I mean, that's incredible service. We've been keeping our groceries outside in our garage for at least 6-7 hours. And then we're selectively picking stuff out, wiping it down. We have a Clorox wipes, and we're putting it in the refrigerator, and we're leaving everything else out in the garage and really only getting it if we need, just to be extra safe.
Yeah, that's very smart. So back to our elderly, so those steps, staying, preventing exposure, minimizing, getting it from surfaces, and still the, main way of transmission is person to person, right? So we can't always be 6 feet apart in grocery shops or, pharmacies. So do your best, the face covering, the facial covering will help. And because once our elderlies get sick, right, they're at much higher risk. And that's when you, again, call your internist or family medicine doctor, explain your symptoms, and if there's shortness of breath and they're not looking well or they're dehydrated, right, that's the last resort, to go to the hospital. And we hope that with additional, personal protective equipment at the hospitals, additional staff, everybody from the hospital administrators to the city's government to the state government, federal government, everybody's trying to kind of be there for not just our elderly, but for anyone affected. It's just, as has been a real challenge.
I have just a few more questions. We haven't spoken at all about the person that is type 1 that is pregnant. I'm assuming it's sort of the same common sense applies to someone that's pregnant?
Right, because this has all been very recent. The Wuhan epicenter started in the fall of 2019, so we really only had data for 3 to 4 months. Thankfully, there's very little transplacental transmission documented, which is reassuring. And there have been, I don't know any specific type 1 literature on pregnant women giving, birth to COVID or having COVID during, but in non-type 1 patients, even women who got COVID, those babies were fine. But there have been reports where a baby was born not healthy, but they can't determine if it was from COVID or another, complication. So unfortunately, we don't have a lot of data.
Yeah.
But because we know that having type 1, doesn't increase your risk for more serious, outcome, like you said, I think just general guidelines and trying to minimize, routine visits, right? Because that's another concern. You may want to have routine ultrasounds because you may be a high risk, future mom, and then you're risking exposure. So that's a really challenging case, I would say, for our OBGYN colleagues, right? How to balance that more careful monitoring for our type 1 moms and yet not overexpose them. So I wish we had more answers. It's such a unprecedented time.
Yeah, I know I'm really asking some difficult questions, but I can imagine someone that's pregnant would be afraid to give birth in a hospital at this time.
Very true, very true. And yet if they have type 1 diabetes, right, and they need that extra monitoring and they need that, most moms want to give birth on the bleeding floor of a hospital, right? And the rare chance that something needs more assistance, right? So those are very challenging questions. I know that the OB/GYN are very meticulous at screening, at keeping visitors out. That's another difficult part, as you mentioned before. You know, right now, many of our moms are giving birth alone. Their spouse or partner or, you know, they're not allowed because of that extra risk.
Wow, it's so heartbreaking. I mean, it's almost like we're living in a nightmare. We are. This is unbelievable what we're all having to do.
Absolutely.
Thank you
For being there for everybody. Wow. Do you recommend some kind of preventative supplements like extra vitamin C supplements? I've read is, you know, very helpful. Vitamin D supplements, zinc. Any opinion?
Right. Another great question. So there's a lot of information out there for things like zinc, ginger, garlic, onion, vitamin C. So far, no large studies have been done to see whether they prevent, you know, getting sick once you're exposed or, you know, improve the outcome. So really, we can't recommend, right?
Yes.
But all those things, I think, kind of common sense wise, are there to boost your immune system, right?
Yes.
All like vitamins, minerals are good. That's why we encourage all our patients, whether they have type 1 or not, to eat more fruits and veggies, right? So you may say, you know what, we don't know, right? The real answer is we don't know if they do anything. But some of our, you know, parents, my parents say, listen, can't hurt, you know? And I think that's kind of like wisdom, you know, before we had antibiotics and that's all people had, you know? And so I think there's a lot to that. I think, you know, even simple things like taking care of yourself, sleeping well, you know, nutrition, making sure you're eating those 3 meals and 2 snacks, because let's face it, it's, you know, a lot of people have anxiety about this, especially those who already had anxiety or depression and now have to live through this challenging time, right? And they may not eat well, they may not sleep well. So if your body's already kind of tired and, you know, dehydrated, and then you make that one trip in 2 weeks to the grocery store, who knows if this virus is not going to be more, you know, contagious to you because you're now sick and, you know, under the weather, so to speak. So from that perspective, I am a believer in, you know, vitamins and minerals and good nutrition, right? So, you know, that's part of it. And also, Kimberly, to touch upon what you mentioned, you know, our emotional health, right?
Yes.
And especially for us dealing with our type 1 children and young adults and the families of, right? It's hard enough to deal with the, you know, the ups and downs of blood sugars, right? Now we have this, you know, very anxiety provoking situation. In addition, our kids are learning at home, right? Which is not easy. Zoom learning, many of us are working from home, right? So let's be there for each other emotionally, right? And as scary as it is, knowing that, you know, we have to really watch our blood sugars because we can't so easily jump into the urgent care. We don't want to be there right now. It's an additional kind of, you know, anxiety provoking thought. But I'm sure, as you have also, like, a lot of good, kind deeds have come out of this, right? What you're doing now is, you know, hopefully going to touch and help so many others and answer questions. And I want to thank you for doing this and, you know, including me, because I feel like it's something, you know, so touching and meaningful and inspirational that you're doing for all your, you know, type 1 community members. And
this is something that we'll never forget. And the type 1 families, yeah, you're right. We do worry. The worst case scenario is not knowing how to help your child and then being faced with, do I go to the hospital or do I not go to the hospital? And as you said, I believe in prevention. And when we're finished, I'm going to do a separate video just on some of the things that I'm doing at home. I'm a licensed acupuncturist and herbalist for 20 years, and I'm just going to share some basic things that we've been doing. Knock on wood, we've been pretty lucky, right? So I actually, one question that, actually 2 questions about vaccine. I'm assuming it's your opinion, there isn't any data, but people that have gotten the flu shot already this year, do you feel that that might be a little extra protection against the coronavirus?
You know, so far data has not shown that. There are different families of viruses, okay? Influenza causing virus is very different from this coronavirus, which is actually more similar to the SARS or the MERS that we've had years before.
Uh-huh.
No.
Okay. And what is the latest in the medical world about a vaccine? I've heard varying timelines.
So far, you know, I know they're working both on the vaccine as well as antiviral therapy, right? Like a Tamiflu-like something, right?
Mm-hmm.
Countries are working on it. Many, both, you know, private laboratories and, you know, government centers. So it's in the works. Keep in mind that, you know, what ordinarily would have taken years, right, of testing and, you know, safety, you know, protocols now is being expedited as much as possible to bring this out. But
Yeah.
right now we don't have anything, but I can assure you that it's, you know, in the works. And as soon as they have something that's both safe and effective, you know, thankfully for what it's worth, we're living very quick data sharing, you know, worlds that will hear about it.
So Dr. Shapiro, thank you. What a wonderful afternoon. How lucky am I to spend time with you and for you to share all this great information. So many people out there very grateful for your time and for your expertise and for really reassuring us. I think too that just because we have type 1 doesn't mean we're necessarily at a greater risk. We need to be smart, take care of ourselves, stay home, obviously follow all the guidelines and really put them into action and help each other. And thank you so much for being on the front lines to you and your husband. Amazing. You're just earth angels, really. Thank you so much.
Kimberly, thank you so much. First of all, for including me as a part of this, you know, inspiring project. I'm really grateful, you know, and again, I'm not by any means the expert, but I'm grateful to be able to share this with you and be a part of this exciting journey. And I just want to wish all of our families who are listening to stay healthy, to stay safe. And, you know, I hope that in a time, hopefully not too far from now, we'll be able to return actually seeing each other face to face, because, you know, I miss my patients. I miss seeing them. I miss hearing about their, you know, soccer and their theater productions. But at the same time, I'm really touched by how much good has come out of this, how many people are looking out for their neighbors, providing that emotional and, you know, support, you know, sending all of their warm thoughts. So thank you so much, Kimberly, for what you're doing. Everyone stay safe, stay healthy. And I hope that next time we do this, we'll be in the same room.
Yes.
It's been exciting. Diabetes, you know, webcasting, but hopefully in person.
Yes. Wonderful. Thank you.
Thank you so much.